A different medical problem facing the country is a growing shortage of nurses. Tonight, Stephen Gear begins a special assignment report on the nursing shortage, a crisis in health care.
That's it, just a little at a time. That's a boy.
Nurses, angels of mercy, the earthly embodiment of the heavenly virtues of tenderness, selflessness, and dedication.
I've chosen nursing because I've always enjoyed working with people and helping them. And, you know, for people who can't do for themselves, I enjoy being able to help them. And if you're willing to do that, then it really shouldn't matter how much money you make.
Nurses, underpaid, overworked, burned out, on strike.
As far as being treated as professionals and paid as professionals, it doesn't exist. It's nothing like what I had thought it would be 19 years ago.
It's just being busy every moment and then getting off duty and still feeling guilty about what you haven't been able to do.
The entire financial situation, benefits, wages, has to be upgraded so that nurses will be drawn to the profession.
The frightening fact is that nurses are leaving the profession. There are 1,400,000 registered nurses in the United States, but only 600,000 are working full-time, and U.S. hospitals report 100,000 nursing vacancies. The Labor Department estimates that 85,000 new nurses will be needed each year through 1990, but in 1980, only 77,000 RNs graduated.
Somewhere the quality of care has to suffer sooner or later, so what do you decide to do? Do you decide to change the linen only every other day? Do you decide to give a bath only every other day so that you can get the technology done? There is a great, big problem coming very soon.
The problem is already here. New York City's municipal hospitals, short of 1,000 nurses, provide only minimal care to the less than critically ill. The Truman Medical Center in Kansas City can't use 8 of 20 intensive care beds because of the nursing shortage. 4 of 5 nurses in a national survey say they are unable to provide an acceptable level of care because of understaffing, a condition reported by 60% of U.S. hospitals. 53% of nursing homes are understaffed, and with the growing proportion of elderly in the population, the demand for nursing home care is increasing.
If we do not approach the 85,000 nurses a year that we need, the American healthcare system will suffer. There is no way around it.
The nurse who provides the care for you in the hospital these days may be a stranger to that institution.
Could you tell me a little bit about your experience?
There's a boom in agencies or registries which supply temporary nurses. Those who sign up can choose their own schedules and are better paid than staff nurses. Although reputable agencies screen and test the nurses they represent, some hospital officials say the use of registry nurses is dangerous, especially if a nurse has never worked in the hospital before.
She doesn't know the physician. She doesn't know the physical setup of the hospital. She's never worked with the paperwork on the chart. And she may be sent to take care of the patient who had open heart surgery that day. Nothing may happen, but something might happen, and there's the risk.
Ironically, while hospitals are struggling to find nurses, the Reagan administration is planning to slash federal funds for nursing education by more than 80%. And there are federal and state Medicaid cuts. At the University of Illinois Hospital, for example, this year's payments have been reduced by $4.5 million. 140 housekeeping and transport workers have been laid off, and nurses will take up the slack.
But if they're on a patient unit and they're busy trying to get a floor cleaned up in the middle of the night so no one breaks their neck on it, and another patient needs them, it's awfully difficult to determine which place to be in first.
Adding housekeeping chores to nurses' duties does more than jeopardize patient care. It also reinforces the frustrations nurses feel when they're put in the stereotyped role of the all-purpose hospital slave, as the president of the American Nurses Association reminded us.
That is, do as you're told, learn at the bedside, and that's really all you need to be a good nurse.
And what do you say about that
in a word? Hogwash.
Is there a solution to the nursing shortage? The American Nurses Association contends that the long-term answer lies in the upgrading of standards for nursing education. Tomorrow we'll take a look at that controversial proposal and at efforts hospitals are making to get enough nurses now. Stephen Gear, ABC News, New York.
In the background is the fact that the entire nursing profession in this country considers itself to be at a kind of crisis point. Medical correspondent Susan Spencer explains why.
Around the country, hospital administrators are recruiting nurses from abroad, visiting job fairs to promote nursing as a career, and sometimes even enlisting nurses themselves as bounty hunters for more RNs.
If a staff nurse recruits another nurse and they remain on staff for a year, they receive a monetary bonus of $1,000 at the present time.
There have been shortages before, but this one is deeper and more desperate and hitting hospitals and nursing homes in every state.
The number of vacant positions has doubled in the last 8 months. So this may be one of the most quickly advancing nursing shortages that we've seen.
It's a wonderful profession to be in, and you get a lot of gratification from it, but it's a hard time right now.
Hospitals are fighting traditional complaints of low pay and bad hours with new career programs, flexible shifts, pay incentives. But nurses say the main cause of this shortage is the new government system of hospital reimbursement. It shortens hospital stays, but brings in far sicker patients.
Hospitals have become giant intensive care units, and that's the workplace. That's where nurses are working today.
Others agree that changes in the national health care system have made nursing in the old Florence Nightingale tradition very difficult.
I was overwhelmed with the amount of patients that I would have to take care of, and that works on you, emotionally and physically. And I just got, I guess, the basic nursing burnout.
Libby Mays, like thousands of other nurses, left the hospital to work in a new area of health care, a group health practice. Some leave the field altogether, often for jobs not open to women when they first chose nursing. None of which makes the job of the nursing schools any easier. Enrollment this year is down roughly 15%.
There are recruiters in all of the high schools and even the junior high schools, and in some instances in the elementary schools.
But it will be a long time before those nurses are on duty. Until then, hospital administrators only hope the current trend will change before care really begins to suffer. Susan Spencer, CBS News, Washington.